Hello everyone. Today we will talk about appendicitis. When your appendix becomes sore, swollen, and diseased. So, what the appendix function and why do we have an appendix? The entire digestive tract helps with our immune system, but some scientists and doctors think the appendix may be a place for our body to store creating healthy types of a good bacteria that otherwise could be alerted or changed during an intestinal illness or with overs of antibiotics. So, what is acute appendicitis? Acute appendicitis is a severe and sudden cause of appendix. It is most common in children and young adults between the age 10 and 13 years old. There are sores and occurs more frequently in males than females. Pain tend to develop and intensify quickly over the course of one day. If require immediate medical treatment, if left untreated, it can cause your appendix to rupture. This can be a serious and even fatal complication. Acute appendicitis is more common than chronic appendicitis. The chronic appendicitis is a less common than acute appendicitis. It occurs in only about 1.5% of all people who have already had a cause of chronic appendicitis. In a chronic cause of appendicitis, the symptoms may be relatively mild and are thought to usually occur following a cause of acute appendicitis. Symptoms may disappear before reappearing again over a period of weeks, months, or even years. This type of appendicitis can be challenging to diagnosis. Sometimes it is not diagnosed until it develops into acute appendicitis. Chronic appendicitis can be dangerous. Get the information you need to recognize and treat this condition. So, what is the sign and symptoms to appendicitis? Appendicitis pain often starts off as mild cramping in your upper abdomen or belly button area that then moves to the lower right quadrant of your abdomen. This pain often begins suddenly, gets worse when you move or cough. It so insists that it wakes you from sleep. Is severe and different from other abdominal pain you have experienced. Worsen within a few hours. Other symptoms of appendicitis may include nausea, vomiting, anorexia, migrating pain, constipation, pyrexia tachycardia, rib pain, rewind gradient. Positive sign, which mean low-grade fever, and it may happen diarrhea, inability to base gas. If you constipated and you suspect that you may have appendix, avoid taking Lasix or using as an enema. This treatment may cause your appendix to burst. Cannot your doctor if you have tenderness. It is a right side of your abdomen along with any of other symptoms of appendix. Appendix can quickly become a medical emergency. Get information about this condition to know what the treatment. This is a serious condition. So, what about the complication? Appendicitis can cause serious complication if your appendix rupture. which can cause fecal matter and bacteria to spill into your abdominal cavity. A ruptured appendix can lead to painful and potentially life-threatening infection include perfusion, abscess, peritonitis. To prevent and manage complication, you should make some steps. Let's start with perforation. Perforation when the appendix bursts and bacteria spill into your abdominal cavity. The lining of your abdominal cavity or peritoneum can become infected and inflamed. This is known as peritoneum. It can be very serious and even fatal. Symptoms of peritoneum may include fast heartbeat, tachycardia, high fever, shortness of breath, and rapid breath. Severe and continued abdominal pain. Treatment include antibiotic and surgery to remove the appendix. Abscess. An abscess is a painful pocket of pus that forms around a burst appendix. These white blood cells are your body way of attempting to fight the infection. The infection must be treated with antibiotic and the abscess will need to be drained. Drainage may occur during surgery. Species in race cause bacteria from a ruptured abscess may travel through your bloodstream to other parts of your body. This extremely serious condition is known as sepsis. Symptoms of sepsis include high or low temperature, confusion, severe sleepiness, short of breath. So the peritoneum, perforation and abscess. This is a complication. What about a diagnostic? Diagnostic is a very important step to treat the appendix. So the one is a blood test to check for your sign of infection. And to conduct this test, they will collect a sample of your blood and send it to a lab for analysis. Appendicitis is often accompanied by bacterial infection, and infection in your urinary tract or other abdominal organ may also cause symptoms similar to those appendicitis. Urinary test to rule out a urinary tract infection or kidney stenosis as a potential cause of your symptoms. Your doctor may use urinalysis. This is also known as a urine test. A pregnancy test. Ectopic pregnancy can be mistaken for appendicitis. It happens when a fertilized egg implant itself in a fallopian tube. Rather than the uterus. This can be a medical emergency. If your doctor suspected you might have an ectopic pregnancy, they may perform a pregnancy test. To conduct this test, they will collect a sample of your urine or blood. They may also use transvaginal ultrasound to learn where the fertilized eggs had implanted. Pelvic exam. If you were assigned female at birth, your symptoms might be caused by pelvic inflammatory disease, and appendicitis or another condition affecting your reproductive organs. Abdominal imaging test. To check for inflammation of your appendix, your doctor might order imaging tests of your abdomen. So this can help check for signs of inflammation and abscess or other problems with your appendix. Abdominal abscess, fecal infection, inflammatory bowel disease. Your doctor may order one or more following imaging tests. in the lower right lobe of your lungs can also cause symptoms similar to appendicitis. If your doctor thinks you might have pneumonia, they will order a chest X-ray. They may also order an ultrasound or CT scan to create detailed images of your lungs. So, what is the treatment to appendicitis? The best choice is surgery removal, appendectomy, pain control, nausea control, NPO, IV fluid, antibiotic. In some cases, your doctor may use laparoscopy or perform minimally invasive surgery. In other cases, they may have to use open surgery to remove your appendix. Thank you for your listening. I am a practical emergency nurse, Nermeen